A global advocacy group for dementia patients is urging governments to prioritise those with the disease for COVID-19 vaccination. Alzheimer's Disease International says those suffering from dementia are disproportionately affected by the pandemic. It cites a recent study in 9 countries which shows that this group formed as much as 2/3 of long-term care patients who died from COVID-19. The findings were revealed during a virtual conference that discusses dementia. Chris Lynch, Deputy CEO of Alzheimer's Disease International, joins us now for more on this story. Chris, your organization has characterized the plight of those with dementia during the pandemic as a double whammy. Now, what are the challenges being faced by the community?
Thank you. Yes, the challenges really are disproportionate for people with dementia. I mean, age is the biggest risk factor for dementia, and older people are most susceptible to COVID-19. So those two constituencies overlap greatly. And as you mentioned, some of the dementia mortality rates that we're beginning to get from governments around the world are revealing just how vulnerable this group is, up to 2/3 in Canada, 26% in the UK, 41% of all COVID-related deaths in Australia. And the challenges from that, as well as directly to health, also in terms of day-to-day, care services, support services globally had to completely shut down face-to-face support. And during the course of those initial few months, that support wasn't replaced. And I think that associations globally have gradually been able to find innovative ways to replace some of that support, using technology, using Zoom, finding ways to re-engage, to provide some one-on-one support and some group therapy as well. But genuinely, the disruption has been to treatment support, also to research and to clinical trials.
Chris, you're also calling for more countries to urgently share their data across borders on dementia COVID-19 deaths. So what's at stake?
Well, basically, it's so difficult at this stage to actually get governments to transparently declare what the mortality rates are related to dementia. The countries that I've named so far are the only ones that have come forward with these figures. But we know that the scenario is going to be very similar in lots and lots of other countries. But by revealing the data and by reacting to the data, other countries will also be able to prepare better for it. And I'm particularly thinking as we experience second and third waves in countries around the world where scarcity of resources continues to be an issue, then it's absolutely essential that this data is not only transparent, but is being measured and captured by governments.
Chris, Singapore has been working to increase services and resources for dementia patients over the years. How do these efforts compare to other developed countries with similar demographics?
Yeah, Singapore has a good reputation in terms of the resources that they have developed. And I suppose benefits, as a lot of other high-income countries do, in terms of having the financial resources, having a national plan, which is a really, really big first step for most countries. And just on that note, the World Health Organization released the Global Action Plan on Dementia in 2017. And the primary call to action there is for 194 member states, countries of the WHO to develop national dementia plans, national dementia strategies in response. And so far, there's only 33, and Singapore is one of those countries. And we need to use those as exemplars for other countries as well. But there's an awfully long way to go to meet the 2025 target, which is 75% or 146 of those countries to develop national dementia plans.
Well, thank you for coming and sharing the situation with us today. We've been speaking with Chris Lynch, Deputy CEO and Director of Policy at Alzheimer's Disease International.